Iron deficiency, defined as an absence of requisite iron in the body, creates lasting deficits in infant psychomotor development long term. In 1989, Thomas Walter and colleagues set out to determine if iron status does indeed affect newborn cognitive growth, and if so, how do duration and level of deficiency affect impairment severity. Deficiency is measured on the amount of oxygen-carrying hemoglobin present in the bloodstream on a no deficit to anemia spectrum. The researchers examined 189 infants using a controlled no deficit group, a mildly deficient group in between, and an anemic group. Indices of the infant's progress at the time of testing included a separate scoring scale for cognitive intellectual growth and for motor movement development. The study found that infants classified as anemic had significantly lower cognitive and motor development scores than controls, and with increasing time duration, the severity of deficit increased. Walter then attempted to correct poor iron status in participants using a double-blind placebo study. He did find a reversal of anemia occurred in all infants, but saw no significant psychomotor improvement in either group. Once anemic infants still showed noticeable deficits in the areas of language comprehension, in balance, and in body control. Compared to the controls, they were also less responsive, attentive, goal-oriented, and vocal. Babies in the study, whose deficiency never progressed to full-blown anemia, even if mildly lacking iron, did not show severe problems. These discrepancies in psychomotor abilities continued to show over time, and were still prominent and evident in infants with corrected anemic status as they reached the age of matriculation to primary school. Versus normal peers, they had trouble balancing on one foot and performing repetitive physical movements. Walter concluded that only a severe depletion of iron causes serious psychomotor problems in infants, and that the only way to prevent the occurrence of developmental deficits from iron deficiency in infants is to maintain healthy iron status from birth.